Let's Talk About Kidneys takes a deep dive into the chronic kidney disease patient journey. We're here to inspire meaningful conversations and to help people living with CKD gain a full understanding of their disease.
Tune in today to learn what Dr. Mohammed Qureshi, DNA transplant nephrologist, has to say about the transplant process, testing, immunosuppressive medications, candidate requirements, and their care plan. He also provides insight about the journey of the transplant patient, including kidney donation programs, types of donors, post-transplant care, and the care team members involved with the patient's care.
Welcome, Dr. Qureshi, today to our podcast. We are so excited to have you as our guest. How do you feel about being in our podcast studio?
Wonderful. A little bit nervous, but feeling great.
Oh, you are going to do excellent. And I think one of the things that is going to be really interesting about this topic is that, when patients are going through the chronic kidney disease process, they have to start thinking about their renal replacement therapy options. So today, as you know, we're going to talk about transplantation. So with you being a transplant nephrologist, I think it's a great fit. Are you ready?
Yes.
All right, let's do it. Okay. Why does a patient with chronic kidney disease need to consider getting a kidney transplant?
So definitely there are both mortality and morbidity benefits for getting a kidney transplant. That means you live longer and you live better by getting a kidney transplant versus staying on dialysis. If you look at the studies, 50% of the patients do not make it to 5 years after starting that dialysis, unfortunately. And compare that to 80% of the patients who live a healthy life at 5-year mark with a kidney transplant versus continuing on dialysis. So there's a huge benefit in living longer with a kidney transplant. And not only living longer, you live better too, because now you don't have to do dialysis. You do not have to follow all the dietary restrictions that comes with
Right.
doing dialysis, right? And so there are all those benefits. You pretty much live as close to you would have lived with before having a kidney failure on transplant versus continuing on dialysis.
Okay, so that's good information. So I'm sure that people listening want to know who even qualifies to be a candidate for transplantation.
Excellent. So anyone who has kidney function less than 20% or someone who has already started dialysis on a chronic basis can potentially qualify for a kidney transplant. And once the patient gets referred to the transplant center based on those criteria, then it's up to the transplant center to make sure that they're healthy enough to undergo the transplant surgery, healthy enough to tolerate all the immunosuppressive medications that they have to be on after receiving a kidney transplant. So there is a thorough evaluation by the transplant center that undertakes once the patient meets the minimum criteria to be referred.
Okay, and so can you give us an idea of the type of testing that is done during the pre-transplant evaluation? Because you just kind of talked about the patient has to be healthy enough. They have to have a, EGFR of a certain level, but what are the details of the pre-transplantation?
So once the patient makes it to the transplant center to see if they are a good candidate for a transplantation, there are two considerations in our mind. Once I see the patient in the pre-transplant clinic, I see them make sure that their heart is healthy enough to tolerate the actual transplant operation. Because as you know, the transplant operation itself entails, you have to have a healthy enough heart to tolerate the surgery and the anesthesia. So a lot of times that's done by doing a stress test or sometimes even a cardiac catheterization with the help of our cardiology colleagues. And the second consideration for all the testing is to make sure that whether they can tolerate the immunosuppressive medications or not. As you know, once patient receives a kidney transplant, then they have to be on these immunosuppressive medications pretty much lifelong to make sure that the organ stays, body does not reject the organ. So those immunosuppressive medications comes with certain risks. And the main risk is the risk of infection and the risk of cancers. So before anyone gets a kidney transplant, we make sure they do not have any infections that they already have, any pre-existing infections. And typically that's done by doing some blood tests, some serologies, to rule out HIV, hepatitis, any latent TB, or, depending on where you live in certain areas, there are certain endemic infection, making sure you rule those out.
Okay, so let me pause you there. So when you talk about the different infections and the immunosuppressive medications, can you give us an idea again, like an example.
So for example, so we'll talk more about those immunosuppressive medications, but there are, immunosuppressive medications are the medications that a patient has to take after the kidney transplant to
Right.
make sure that the body does not reject the kidney, right?
Exactly.
And those medications, just like any other medications, comes with risks. And the main risks with those medications is that they can make you more prone for infections and certain cancers, right? I mean, those medications are great because they prevent the rejection and make sure that the kidney stays in the body, keep functioning. But so as I said, it comes with the risks. So we mitigate those risks by, before someone get a kidney transplant, making sure they do not have any pre-existing infections that are undiagnosed.
Okay.
And the
Okay.
same thing goes for the cancers. Before someone gets a kidney transplant, we make sure they do not have any undiagnosed cancers. So we do age-appropriate cancer screening, right? So for example, for women, anyone, all the women pretty much get Pap smear, a mammogram. Men get prostate cancer screening, and if you are more than 45 years of age, then you get colon cancer screening in the form of colonoscopy. And everyone gets some kind of an imaging, some chest imaging in the form of a chest X-ray, and some kind of an abdominal imaging, mostly in the form of abdominal sonogram. But some patients also need a CT scan depending on their risks.
Okay. So everything that you're describing kind of entails the patient journey to transplantation. So you're discussing the pre-evaluations, the different tests. What are some other things that are considered as the patient goes through their pre-transplant journey?
Yes. So it's not only the transplant nephrologist who evaluate the patient; it's actually the transplant surgeon. There's a dietitian. There's a social worker who evaluates the patient in that pre-transplant process. The surgeons make sure that the patients, because as you know, the kidney transplant happens in the lower part of the body, of the belly, of the abdomen. So the surgeons make sure that starting off you're not obese. Your BMI is in a decent range, so
Okay.
that after you get the kidney transplant, then wound healing is not a problem. Then the social worker makes sure that you have adequate coverage for your medications. As I said, those medications, the immunosuppressive medications, have to be taken lifelong. So, the social worker, the case manager, makes sure you have adequate coverage from your insurance for those medications.
So what are some other things that the social worker considers? I know medication and being able to cover those. What are some other aspects that the social worker covers?
So there's something called a care plan. So
Okay.
every patient who gets a kidney transplant, we want to make sure that they have adequate care plan. That means that they have someone who will be able to at least help them out for the few months after the kidney transplant,
Right.
because they have a fresh surgery. We want to make sure that there's someone who at least is with the patient to take them to the appointments that they have to go after the kidney transplant process. They have some kind of a social support, someone to drive
Okay.
them back and forth for the appointments. Not a lot, but at least the social worker identifies few people who are willing to help out the patient once they have a kidney, especially in the immediate post transplant period.
Okay. Can you touch just quickly on the dietitian's role in the pre-transplant evaluation?
Excellent. So as I said, a patient has to be at a good BMI. Typically, we consider a good BMI, which is body mass index, which tells how much weight a patient has. A good BMI would be ideally under 30, or a BMI at least less than 35. So the dietitian, once they evaluate the patient, they make sure that the patient is not obese, and if they can lose some weight, they help the patient getting to the weight which will be an ideal weight for a patient to undergo a transplant surgery. And also check for the frailty. If the patient is very frail, they you don't want to have a patient who is very frail to begin with, because
Right.
after the surgery,
There
the
there is
chances.
weight loss, yes,
Exactly,
for
there's weight
sure.
loss. You are in bed for 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 a few days at least. So you want to start off at a good point where you're not too frail. The dietitian evaluates the patient from that standpoint as well, and if they need some physical therapy, they refer the patient for that as well.
Okay. And then you're a transplant nephrologist. So can you talk about the role of the transplant nephrologist during the pre-evaluation process?
Yes. So once the patient goes through all the pre-transplant screening and tests, then they get put on a transplant list, right? And that transplant list, just to kind of briefly kind of do that before we go the inpatient role, is there's a organization called UNOS, which uses a centralized computer system to match the transplant programs and the OPOs, which is the organ procurement organizations. They have a centralized computer system which uses algorithms to match the right recipient with the right donor. And once that match happens, then the patient gets a call for a kidney transplant.
Okay.
And as you were asking, once the patient moves up the list, and then they get called for a kidney transplant to the transplant center, then as a transplant nephrologist, that's when we check the patient one more time. Let's say patient comes in, and they have received an organ offer. Then the first person that they typically see is a transplant nephrologist, who makes sure one more time that the patient is nothing has changed from the last time they had all their evaluation, and they're still a good transplant candidate. Typically, that entails making sure that they don't have any active infections, they don't have any active wounds. They get some blood work done just before the transplant surgery as well to make sure that they are a good match. There's a cross match that happens, making sure that the kidney is compatible. And then some these days we have to do COVID screening and other some of those other tests to make sure just before the transplant surgery that everything is still right, and then the patient undergoes the transplant surgery.
Okay. Okay.
And as a transplant nephrologist, we kind of pretty much follow the patient throughout the course, not only in the pre-transplant course, right before the transplant, and then right after the transplant when they are still in the hospital, making sure that they get started on those immunosuppressive medications that we just talked about. Again, there are different type of immunosuppressive medications that we have to use for the patient at the time of surgery, which we call an induction immunosuppressive medication. And then subsequently, the lifelong immunosuppressive medications, which are called maintenance immunosuppressive medications.
Right. Right.
Um,
I remember the gigantic pill box, the pill box of eternity. It's sometimes it's what 50 pills a day. And, as you start to recover during that transplant recovery process, some of those medications, I remember them dropping off because, the first transplant that I had, that was very overwhelming. Like, oh my God, I'm going to have to take 50 pills a day. But, that's essentially cut in half. So, what kind of care is needed once a transplant happens and the patient is discharged? We know that when they're in the hospital, they're getting that round the clock care. They're seeing the nephrologist, they're seeing the surgeons, they have the nurse practitioners. Everyone's kind of, making sure that each day, each hour, they're having that care. So, can you talk about the care that's needed once patients are discharged?
Yes. So once the patient gets discharged from the hospital, your transplant nephrology team still follows you rather closely in that post-transplant, post-hospital phase as well. Just to give you an idea, we as transplant nephrologists see our patient very frequently, especially in the initial post-transplant phase. We get to see our patient 3 times a week for the first 2 weeks.
Yes.
And then, after that, twice a week for another 2 weeks. And then after 1 month, typically once a week for another month. So you get an idea that how frequent we see the patient, realizing that they are on all those new medications which they are not familiar
Right.
with, right? So those immunosuppressive medications, need some adjustment, some tweaking as well, especially in the initial phases. So the patient gets followed very frequently, and during those time, your transplant nephrology team, your dietitian, your social worker, your pharmacist still keep involved in the patient care to make sure that nothing falls apart and the patient is comfortable with the new medications, right? So as you know that in the post-transplant phase, there can be certain complications, right? So we have to follow the patient very closely for that. For example, if the new wound that the surgery where the patient has the surgery, there can be some surgical complications. You can have a wound infection. In that case, we refer the patient back to the transplant surgeon, make sure that they provide adequate care. Sometimes they develop some infections that we were talking about earlier. So
Right.
that screening happens in the post-transplant phase as well. And sometimes we need our help with the infection disease colleagues to make sure that they help with the infection management. And, more long-term, for subsequent months and years, the risk of cancers can go up. So patient gets some screening even post-transplant phase as well. Make sure that they have not developed any new cancers or or any chronic infections for that matter as well. So the journey is pretty much lifelong. Once you
Yes, it's a lifelong journey for sure, for sure.
Yeah. And then, your transplant team, your transplant nephrology team is there to help you. I could tell you in our transplant clinic, we follow the patients. We have patients who have had kidney transplant more than 25 years ago. And we, obviously we don't see them very frequently, but we still see them, on a fairly regular intervals. So it is, as you know, it's a lifelong journey, and then we are here, there to help our patients navigate through all of that. And,
Right.
you know,
And in talking about the lifelong journey, I know that if there are patients out there that are looking to have a transplant or have had a transplant, I can speak from, experience in saying that keeping those appointments, even if it's, going in for your labs, even if you feel everything is, functioning and working properly, because, anything can happen if you aren't, in the consistent care of your nephrologist and your care team. So I would definitely second that notion and support that. So now let's talk about the different transplant options that are out there. We talk about the deceased donor versus the living donor. In your opinion, or is there an opinion even standard on which is better for each patient?
okay. I think that's an excellent question. So transplant at any given day, whether living or deceased, is definitely superior, compared to continuing on dialysis. So that's, as I showed you those numbers earlier.
Yes.
So that's a given. But between the two different types of transplant, living versus deceased, living transplant is superior, for various reasons. Number one, the living transplant happens in a much controlled setting. You already have a date as to when you're going to have a kidney transplant. It is coming from a living person, right? So the kidney in the deceased donor scenario sits on a pump or an ice for a certain period of time before it gets implanted or put in the recipient. Versus in the living donor, the two surgeries happens pretty much side to side. In one OR there's a living donor, other OR there's a person who wants the kidney. So there's what we call an ischemia time. There is very minimal ischemia time. So what that really entails is that the kidney pretty much works right away, in case of the living donor compared to the deceased donor, where there can be sometimes what we call a DGF, or delayed graft function, because that kidney is sitting on ice. So the living donor is definitely superior, because you get a better quality kidney. It's a much controlled fashion surgery, and I think the most important thing is that when someone gets a living kidney, they get it in a much more timely manner too, right? Because when you are on a deceased donor list, then you have to be on the list for, depending on how long you've been on dialysis, you can be on the list. It can take up to several years before you get an offer for a kidney transplant.
That's
Compared,
for the deceased.
that's for the deceased,
Okay.
compared to a living kidney donation, when, where you do not have to wait. As soon as you have a living donor available, which is a good match for you, you can pretty much have the kidney transplant surgery within a matter of weeks. So from that standpoint, the living donor kidney transplant is definitely superior, compared to the deceased donor.
Okay, so we're talking about the living kidney donor. We're talking about the deceased donor. How do the relationship even happen? How do those relationships even happen with a living donor?
Very good question. So as you know that, someone is available, someone wants to give the kidney, right? So their intended recipient is not a good medical match, right? Then there are several options out there, through the UNOS or through other organizations, which can help you swap the kidneys. That means your donor kidney goes to the other recipient, and
So
then
let's explain that. So someone has a donor that went through the testing process, they got tested. However, that person wasn't a match for the person that they tested for.
Mhm.
So then now you can talk about the paired
Exactly.
process.
So that's exactly what it is called. It's called paired exchange, right? So that's a swapping. That means your donor kidney goes to the other recipient where there was a match, and then the other person's donor goes to the other recipient. So it's basically one-to-one swap, or it can actually be in the form of chains. Where multiple pairs are involved instead of two pairs. So UNOS is one of the organizations that can help do that. There are other organizations, Kidney Registry, which also help with that process. So I always tell my patients that if you have a living donor who wants to give the kidney, you don't really have to worry about knowing their blood type, knowing whether they are a good donor, whether they're going to be a good match or not, because now you have all these programs, which can help you find the right match for you.
Right.
So I think it can be very overwhelming when you tell our patient, look for a donor. Then they kind of get into this thing, whether it should be a match. I don't know if my donor is the right blood type. I don't know if my donor has this medical problem or that. So we kind of try to ease that for our dialysis patient, telling them, and as long as there's someone who wants to give them the kidney, their job is to just encourage them and help them turn in the application. And what happens from there on, is up to the transplant program. If they're a good match, by all means, that donor kidney goes to the intended recipient. But if they are not a good match, then there are all these swapping programs that are out there, pair donor exchange programs out there, which really help find the right match for the recipient.
Okay. And I think one of the final questions kind of wraps up just everything we've discussed today. Where do patients even find the assistance in applying for transplantation? I know that's something that, we probably could have talked about earlier, but I think it's a good wrap-up question.
Right. So, as you know, typically there is a nephrologist involved by the time a patient needs a kidney transplant, right? As you said, the kidney function has to be below a certain percentage or the patient is already on dialysis. So the nephrologist, your dialysis nephrologist or your general nephrologist, they help you refer to the transplant program. So they have in the CKD clinic, you have the navigator help available. In the dialysis unit, there are social workers who help the patient turn in the transplant applications. So when you're in your nephrologist's office or in the dialysis unit, you already have those resources available,
Okay.
and your nephrologist can help refer you to a particular transplant program of their liking or depending on where the patient lives and the program that they have worked with in the past.
Okay. And so if you had to leave us with one key point from this interview today, which was a wealth of information on transplantation, and, we're hoping that the listeners out there, whether they are personally being considered for a renal replacement therapy option as a transplant, or if they know someone, I'm hoping that it's passed along. So if you can give us one key point, what would that be?
Well, I would say, as we started our talk with, that transplant has a huge benefit in mortality and morbidity benefit. That means you live longer and you live better. So if you have a less than 20% kidney function or you're on dialysis already, make sure you talk to your nephrologist. Make sure you get referred to the transplant program. Whether you qualify, whether it happens or not, is a different thing. But at least you should know that that's an option out there for you, and that's a great option because as we said, it has all those benefits, and you can live pretty much a normal life as you would have before the kidney failure. So don't let this option, you have to consider this option. As I said, make sure your nephrologist refers you and have the word out. And for our general listeners who are not CKD patients, I think kidney donation is still a little bit of a taboo. So we have to make sure people out there realize that there are so many patients who need the kidney transplant, and the kidney donation is a great option, and it does not compromise the donor. The donor has to go through a very thorough evaluation, so we have to try to educate the masses as well, so that we can help our patients with kidney disease get out of dialysis situation and live a healthy life.
All right. So I will say I will end this with share your spare. You got two kidneys, you can live with one, and transplantation saves so many lives and, just gives individuals that longevity and that quality of life that they can't have on dialysis. So thank you again, Dr. Qureshi, for being our guest today. And we know that you provided us with a wealth of information. So we hope that the listeners learn a lot and can share. And if they can share the information or share their pair, I think that would be a great outcome.
Thank you, Tiffany. Thanks for inviting me.
Thanks for tuning in today. Learn more about Dallas Nephrology Associates at www.dneph.com. That's DNEPH.com. And if you found the information valuable, be sure to share with those who are impacted by chronic kidney disease.
Dallas Nephrology Associates DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.